Hello, my name is Ann Mandeville. I am Vice President for Development and Membership at Research America. I'm thrilled to introduce you to our next speaker, Dr. Arthur Evans, Chief Executive Officer and Executive Vice President of the American Psychological Association and a Research America board member. Thank you, Dr. Evans, for joining us today to discuss the state of research on obesity, one of the principal health challenges we face as a nation. Arthur, over to you.
Thank you, Ann. Obesity is a major health problem for our nation. The U.S. has the highest rate of people who are overweight or obese among high-income countries. And this comes with some very significant health consequences. This was an enormous health problem before the pandemic, and the pandemic has only made this problem worse. In fact, the American Psychological Association Stress in America survey has found that 42% of adults reported undesired weight gain since the start of the pandemic, with an average weight gain of 29 pounds. We have also seen an alarming increase in rates of obesity among children during the pandemic. For example, the Children's Hospital of Philadelphia's Care Network found that the prevalence of pediatric obesity increased from 13.7% to 15.4% during the pandemic, and that the increase was greatest among Hispanic, Black, lower income, or publicly insured children. This study mirrors national trends which demonstrate enormous disparities in obesity rates across the US population. Both before and after the pandemic, we saw a higher prevalence of obesity among lower income populations and communities of color. This is often due to an individual's context, like living in a food desert or having less access to safe outdoor green space. From my perspective as a behavioral scientist, I want to share some opportunities for expanding our research and making progress on this issue. The first issue that I'd like to raise is the notion that we need to expand the level of analysis at which we look at this problem. Historically, we have focused on individual behavior, but we know that families, communities, and systems all shape individual behavior. In the US, 60 years ago, 12% of Americans lived with obesity. Today, more than 40% of Americans live with obesity, and that number is projected to reach 50% by the end of the decade in 2030. So the question is, what has happened over the past 60 years? Well, we know that social and environmental context around food plays a major role. And our research agenda, therefore, should place greater emphasis on understanding those factors and developing interventions that we can employ at multiple levels of analysis, including at the familial level, social group, community, and systems level. So the question is, for example, how can we develop interventions that shape environments so that people are more likely to engage in behaviors that protect them against unwanted weight gain and becoming obese? Another area in which we can expand our understanding is in that of translational research. In healthcare, we know that there is a 17-year gap between what we know in the science and what is widely practiced in the field. The health crisis that has been caused by obesity is one that creates an urgency at closing that gap as we bring what we know from research into the mainstream much faster. This will require us understanding a better understanding of factors that impede the dissemination and implementation of our research findings. One example of that is the issue of cultural context. We know that how people relate to food, how they eat and engage in behaviors around food is very much determined by their cultural context. And so we need to have a better understanding of those factors as we think about both the educational interventions that we might do and other behavioral interventions that we might engage in, because those are the factors that will determine how people both accept these interventions and how effective they will be across different populations. And then finally, a third area where I think we can make some progress is looking at the issue of early intervention. We can look at early intervention from two perspectives. One is from the child perspective, and the other is from the process of how we develop weight gain, unwanted weight gain. So let's take children, for example. We know that we can have and develop interventions that can help children develop lifelong habits that protect them against obesity and being overweight. And we need to take a developmental perspective around understanding how those interventions change over the lifespan of a child. But we also know that the process of gaining weight is one where we have some opportunities to intervene much earlier. So that might look like helping people to identify risk factors that are indicating that they are likely to become obese. And then developing interventions that they can use that reduce the likelihood that they have that particular outcome. So there are lots of areas where we can expand our research, looking at different levels of analysis, looking at how we can intervene much earlier, and looking at how we translate research so that it is more likely to be effective for different populations. I hope these ideas are helpful in stimulating our thinking around this topic. Clearly, the crisis that we have around obesity is having a significant impact on the health of the nation, and we have an urgency to bring all of what we know to address that problem.